Hello and welcome to the weekly newsletter with me, Dr. Dhesi from Vysana Clinic. So I'm not actually in clinic today. I'm actually in London just doing some compulsory basic life support training, which I can tell you a little bit more about. But today's topic I was going to talk to you about was skin boosters. I had quite a few questions from the last newsletter about skin boosters. And the one thing I wanted to talk to you about was one that might be appearing more on everyone's radar, which is polynucleotides. And I sort of coined or gave it a nickname of the filler killer, only because the appetite for having dermal fillers, I think overall is decreasing. I think dermal fillers have a great place. You know, if they're used subtly and naturally, they produce great results, especially for volume replacement in areas that I've highlighted before. But polynucleotides are a very interesting thing, and I will explain a bit more about them being the filler killer. So, basic life support training. So this is a compulsory aspect of being a healthcare professional. It explains exactly what it says on the tin. It's how to perform resuscitation, so CPR. That's in both adults and children and infants, and it's part of the ongoing sort of professional development. This is something that is required for all healthcare professionals who are working in a clinical setting. That doesn't necessarily mean that I would have to do it for aesthetics, but because I'm working in the NHS and I'm working in private practice, and because I am a GP and a doctor, I have to do it as part of my appraisal every year to show that I am compliant in patient safety, one of the aspects in patient safety. So that's one of the things I've been doing. Clinic has been relatively busy on the days that we're in. It is the holidays, so I know that a lot of you are busy with looking after children, whether entertaining them or protecting your sanity, whichever it is. It's one of those important times of the year. It can sometimes be exhausting, but when else can we spend time with our families and take some time to enjoy the fleeting sunshine? So clinic, we've again been doing things like wrinkle smoothing injections, preparing for skin treatments, so more maintenance treatments, and tackling any sort of skin issues. A lot of patients actually have been coming in to have cryotherapy. So this is where we use liquid nitrogen to freeze skin tags that might be on the face or on the body, or what we sometimes call solar keratosis, basically anything that's benign. But by doing cryotherapy in clinic, what it gives us an opportunity to do is assess patients' skin and make sure there isn't anything that needs onward referral to a dermatologist or to a skin clinic. We have sometimes identified when we're doing skin tag removal with liquid nitrogen that there are some suspicious lesions that need to be seen and assessed in a hospital setting. On that note, we are planning some interesting things for September. As you're probably aware, aesthetics is a passion of mine. I love talking to you about it. I love delivering treatments, but again, I wanted to focus more on the medical aspect. So this is what we were bringing in. And if you are interested, if you got to this point of the newsletter and you're still engaged, we will be introducing more specialized blood tests, more specialized platform that includes 48 biomarkers that covers everything and every aspect from things like covering tiredness, digestive system, heart health, kidney health, liver health, it will cover it in those biomarkers. And what we will then do is plug those numbers, your results, into a dashboard, and that dashboard will be able to give us a better understanding of what preventative things you can do. Now, we're going to primarily focus it on women's health, but we then will be doing it for men as well, because I'm obviously a man, and I know that many of you are also interested for your partners and your husbands in terms of maintaining or having health prevention for them as well. So keep your eyes peeled. If you are interested, then please do drop me a comment or a direct email and I can explain further. That will be coming. I'll be talking more about that in the next few weeks. So I was speaking about polynucleotides, the filler killer, and the trend in the moment in the industry that fillers, the media seems to be reporting that fillers are out of fashion, skin boosters are in, things like polynucleotides. So polynucleotides are not hyaluronic acid. They are an exciting aspect of regenerative medicine in that they stimulate your own skin cells, your fibroblasts, to either renew themselves and produce more collagen. So as opposed to hyaluronic acid, which we use to inject and replace volume, so where there's volume loss, so for example, these lines here, we might smooth them out or create lift at the cheeks. What polynucleotides do in a slightly slower scale, you need more treatments, but what they do is they help skin regenerate. They harness cell machinery, what your own fibroblasts and your own skin cells are doing, and then they stimulate more collagen production throughout it. They also improve skin elasticity. They can help with improving blood supply to your skin. And interestingly, a lot of studies have shown that they can also help with inflammation and pigmentation as well. So they wouldn't necessarily clear pigmentation, but what they do is help damaged cells renew that are maybe producing too much pigmentation in one area. We call them sort of age spots. and it can actually reduce the effect of those. It can also help with inflammation in the skin by improving blood supply, renewing fibroblasts, which I keep talking about, which are the skin cells. So polynucleotides, we have been doing them for the past 2 years, and we get questions about them. Do we offer them? We do offer them. Not always the best at advertising what we do, but we've been using polynucleotides from various brands since last year, early last year, when I introduced it to clinic, and many of you will know them as skin boosters. We've been using them underneath the eyes, which can help with the crepey skin underneath the eyes. So I hope this little weekly newsletter is interesting. It's my way of reaching out to you and connecting with you. Just in summary, talking about polynucleotides, talking about longevity and biomarkers and more medical assessments we'll bring into clinic. And obviously our focus is working on the skin and then looking at what's going on within as well. So thank you for joining me on this newsletter, and I look forward to speaking to you again soon.